Shortly after President Donald Trump was sworn into office, he has signed an executive order to make U.S. withdraw from the World Health Organization, citing two main particular reasons, claiming one, the U.S. contributes a lot in terms of funding and then financial resources to the World Health Organization compared to their counterparts, especially China. He says the Chinese, which is the most populous country globally, contributes lesser amounts in terms of funding as compared to the United States of America. He also said that the Chinese government exerted undue influence on the World Health Organization during the COVID era. So these are the two main reasons why they've withdrawn from the World Health Organization. A couple of weeks ago, he also placed an order to freeze US aid for 90 days. And this particularly has a negative or devastating effect when it comes to the health globally, especially in Africa. The health sector is facing dire situations due to the frozen command that President Trump has placed for 90 days. And this is quite worrying. So this is now the time for our leaders, African leaders, to now use our resources judiciously. Africans are blessed with vast resources, natural resources from gold, timber, what have you, especially in Ghana. We are blessed, but through corrupt practices, we are not able to harness our resources efficiently and effectively. So within these 90 days, we are going to be facing some hardship in terms of supply of medications, supply of wares, and what have you to African continent. With this 90 days freeze on US aid particularly, there are two things that have been exempted or two orders that have been given. For example, the order on emergency food supply programs, especially to Sudan, and then emergency or military aid supply to Israel and Egypt have been exempted. So these two programs have been exempted. With regards to PAPFA, or a program called PEPFAR, this program was signed into being by President Bush, ex-President Bush in 2003, to combat or to help PEPFAR is a program that was signed into existence by ex-President Bush in 2003 to help care for people or persons living with HIV/AIDS. This program provides emergency response, medication care, and helps in the prevention of the HIV or people living with HIV/AIDS. With this freeze on the whole thing on US aid, is going to affect people who are receiving their antiretroviral medication, because for 90 days, if a particular African country does not have enough antiretroviral medications for their patients, the mortality rate is going to go up. So it's now time for Africa as a continent to now look for other ways and means to make sure we are able to get these antiretroviral medications for our patients. Otherwise, within these few 90 days, it's going to be a heck. It's going to be a hell for people or persons living with HIV/AIDS. So it's a wake-up call to our African leaders. Please, let's work hard and make sure we are able to manage our own resources, because the late president of Ghana, Dr. Osajifo Kwame Nkrumah, said some time ago that the black man is capable of managing his own affairs. Can we do that? Subscribe for more.